Good morning, class.
Good morning, class.
Welcome to my YouTube channel today. And today's class, I'm going straight live on YouTube, so you can connect. You can join my class, and my students on YouTube, please. You can also join my live class so that you learn nursing procedure. So today, at Nurse ClementB, I am going to teach you on how to carry out urine analysis, that is urine testing. Are you having problems? Are you having problems with urine testing as a student? As a student nurse? Do you want to have this procedure at the tips of your fingers? Please watch this video to the end. Join this live video so that you can learn this procedure very well. It is very, very important. You can even teach your relatives. You can even teach some people at home so that whenever there is problem with happening in their bodies, they can easily go and watch. They can easily go and learn, right? So don't forget, please share this link to your friends, to your loved ones. Do not forget that I still remain Nurse ClementB. So just sit back, let's go and learn how to do urine testing and nursing. I'm going to concentrate only in nursing procedure, please. So thank you. So the first thing you are going to do as a nurse when you are going to carry out this procedure, you know, sometimes they will ask, the question will say, carry out glucose tests on this patient or the specimens before you, or carry out protein, depending on the question, right? So you go, what you do, the first thing you will do is to look at the instruction. That is the first step for you to pass that particular exams. Take your time. Take some seconds. You can even take 30 seconds to do that. You will have issues. You will have issues because any exams that you are doing, if you don't understand the question, if you don't understand the instruction, most especially when it comes to OSCE, right? You will have issues. That is the beginning of failure. But when you understand the question, then you will pass, isn't it? Now let's take, for instance, the instruction says that you should explain urine testing. You should explain urine testing to a group of 200 level students. What will you do? You start explaining from the beginning how the procedure is going to start. But if the instruction says that you should carry out, please, you have to carry out the procedure one after the other, step by step. So do not mix explaining the procedure with carry out procedure or perform. They mean the same thing, right? So you just have to do that. So number one is for you to pay what? If you want to pass your OSCE, pay attention, understand your instruction. Not any examiner that will say, no, you don't have why are you wasting time? Moreover, it's OSCE. The examiner is not supposed to talk to you, right? So you just do your thing. So you can take 30 minutes. You can, sorry, pardon me, please. You can take 10 seconds, 5 seconds, 30 seconds to digest the instruction that you want to, that is being pasted on the wall for you to carry out the procedure, right?
Yes.
So you have to do that. So are we clear on that?
Yes, ma'am.
Are we clear on that?
Yes, ma'am.
Any question? All right. So the next thing now is for us to start the procedure after understanding the instruction. So the instruction, for example, says, I should carry out the procedure. So now I want to carry out this procedure. Remember, there is no patient here. You just have a specimen. No specimen, no patient, right? So you don't have to like go and greet and introduce yourself to the patient, go and consent. No, you don't have to do that. It's a specimen before you, then you go straight. I used to call it, most of my students knows that if you're asked to carry out any procedure, of course you must do normal formula, right? Yes. But in this case, you don't have to do normal formula because there is no patient there, right? You don't have to take informed consent, you don't have to screen, right? So you just have to go straight to the what? To the procedure, and that's all. So the next thing now is for me to wash and dry my hands. That is, you have to perform hand hygiene, right? So I have to perform hand hygiene. It's my liquid soap. Pardon me, I'm not using running tap, so I have to use this water, and I will dry my hands. Don't forget, it is important for you to dry your hands, right? It is important for you to dry your hands so that when you are putting on gloves, you will not have issues. The glove will not be sticking to your hands, blah blah. You know, during exams, there are some students, they will be struggling with glove because they do not dry their hands, because the glove will be sticking to their hands. So it is important that you dry your hand properly, and then you put on your glove. So remember, this procedure is a clean procedure, not a sterile procedure. So I'm going to use latex glove. We can come close. You must have your pen ready to write. So the first urine testing is divided into two basic headings. That is the physical assessment and the chemical, right? So you have to physically examine the urine. Then later you use the test strip to carry out what? The chemical examination of the urine. So now I will start with physical examination of this urine. When I was in school of nursing, my teacher then taught me on how to use a formula called Dorcas. So a formula called Dorcas. And most of my students knows what Dorcas is. D stands for what? Deposits. Do you know how to spell Dorcas? Yes. D stands for what? Deposits.
So this stands for what? Deposit, right? So Dorcas like this. So can we spell Dorcas? Uh-huh. Mm-hmm. 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 Okay. So we write physical examination. So do you know that this one will guide you now? This Dorcas that you've written, it will guide you. D stands for what? Opposite. O stands for what? Odor. R stands for reaction. Right? So we go step by step. And C stands for what? All right. You are right. C stands for color. And A stands for what? Who can guess? Amount. A stands for amount. Then S stands for what? Specific gravity. So now that we have written Dorcas, it will guide you to do the physical examination step by step. So let's go ahead. Let's look at the physical examination. Forget that I did not touch any urine. That is what examination of the urine. It is very important that you do physical examination of the urine. So avoid contaminating everything. I keep my this way. Let's look at this urine, right? So our D stands for what? You look at it at eye level. Always remember that if you are doing urine testing, the urine must be in a clear, transparent container like this. Either a beaker like this or a measuring jug like this, right? Something transparent that you can see the color, you can see the amount. A container that is being graduated with numbers like this, right? So you must have something like this, container like this, right? So since we have our urine in a beaker, so you can see the deposit, right? You can even lift it at eye level, or you can even look at it directly. Since my container is wide, I can easily see if there is of course, deposit, and I will write deposit present. Right? So you can do this within like 30 seconds at the same time. The deposit order, reaction, color, and amount, right? So I've done what? The deposit, right? Of course, deposit, there are some inside the urine, right? And let me see the order. I want to know the order of this urine. You know, so some have, if somebody is diabetic, the order of this urine will be what? Sweet. It will have sweet smell. It will have sweet smell. And the normal order for urine is aromatic, right? Characteristic smell. So it is aromatic. So you carry the urine close to your nose and just you perceive it, right? So I have seen, and then I will write my aromatic, right? Order, sorry, and reaction now. I will do reaction and specific gravity last because I don't want to contaminate my pen, right? So, and then what is C? What did I say, C? So let's look at the color. What's the color of this urine? It's amber in color, right? So, there are different colors of urine. Sometimes you will see somebody's urine is what? Deep amber. That means maybe the person is dehydrated. Like this our weather that is hot, isn't it? So maybe I haven't taken water, I've been in the class and I've been sweating. Definitely I will have issues. Definitely my urine will be what? Highly concentrated. Do you notice sometimes you will see the urine is somehow deep, like as if it's what is it? Brownish or some hair. So that color, because the person is dehydrated. But for this urine, the person is not dehydrated, so it's amber in color, right? So sometimes you can see don't forget, you can see the particles. Some particles like the deposit, you can see pulse, you can see blood. So you have to note all those things, right? You have to note it when you are doing deposits. The physical is the color. The color we say is amber, right? It's not just amber color. It's not too clear, right? It's just normal amber color. And the next thing is amount. You see this beaker, right? What are we having here? We have 200 mils of urine. So we record 200 mils amount, right? 200 mils of urine, isn't it? The next thing is, have I done the reaction? So we have done color, isn't it? And then specific gravity, right? So reaction to litmus paper. I am going to use, so now I'm going to remove my pen and put it inside my pocket because I will start touching this urine. So I will remove one litmus paper. Of course, I'm using red litmus paper, as you can see. I'm using red litmus paper. So I'm going to use this particular one to test the reaction to litmus paper. So I dip it inside the urine to see the pH of this urine, right? Then I record. See, please do not forget I discard. I wait for some seconds and I discard. Do not forget, sometimes you can use this Combi 9. This is Combi 9 and this is what Combi 2V. So you can also use this strip to know the pH of the urine, right? You can also use this to know the pH of the urine. Of course, it's been written there. Do you understand? And you can, for this one, it's only glucose and protein only. So most times I like using this because it has a lot of things, properties that you can test. It has pH, it has protein, it has nitrate, ascorbic acid, ketones, glucose. So you can test almost 9 chemicals here with this strip, one strip. And then you can use only 2 if you are using this Combi 2. Only this. You can use, this one is for what? Glucose and protein. So you can use different companies, like this one is another company, this one is another company, and you should be able to follow the instruction of the manufacturer of each product that you are using. Follow the instruction of each manufacturer, right? So the next step now is for us to know since we have our pH here, we can use this Combi 9, right, test strip and take our pH, and then we want to know our specific gravity. So I will do this last so that I will check it like because I will contaminate my. Now I will use this syringe to fetch little amount of urine and I'll put it inside so that I will not contaminate my hand, and I will just pour it directly. Up until now, I don't have any direct contact with this urine, right? Then I will just discard it. I will just discard this in a receiver for use instruments. And I can also leave it here if I want because I may be using it. Right? After getting this, you open the Combi 9. We are going to use Combi 9, right? Remember, if you are using this, it's new. I haven't opened it before. I haven't used it. So you have to first of all check the expiration date. For this, it hasn't expired. It will expire March 2025. So check the expiration date on the container. Check the expiration date on the container. It hasn't expired, so it's good to go, isn't it? So we can go with this strip. The next thing is for me to immediately remove one of the strip, close the container immediately, dip it inside the urine, and remove excess urine by rubbing it at the edge of the test tube, right? So now, as I told you, follow the instruction of what? Manufacturer. So when you look at this container, you will see some minutes, seconds being placed directly to the colors. So you are going to use this strip that you dip inside the urine to compare the colors on the container as been instructed by the what? Manufacturer, right? Can we look up, please? So for glucose, I have 30 minutes, urobilinogen 30 minutes, bilirubin, 30 seconds, pardon me please, 30 seconds, and blood 60 seconds, pH 30 seconds, protein 30 seconds, nitrate 30 seconds, ascorbic acid 30 seconds, while ketones 30 seconds. So it's only blood that has 60 seconds. So you will start with the one. So you start with the one that has less. Let's take, for instance, maybe the glucose is just 10 seconds. You start with that one. So most of the chemicals here, remember I told you that when you are carrying out urine testing, of course we have physical and chemical, isn't it? So we have done the physical aspect of it. We have entered the chemical aspect of the urine testing, right? So now we compare. You place it this way, right? You place it this way, close to the bottle. Do not allow it to touch the bottle, right? It's 30 seconds already. So maybe the instruction says that test for glucose or protein or ketones, isn't it? Maybe that's a diabetic patient, and you need to know whether this the level of the sugar of this diabetic patient, isn't it? Or it has ketones or any other chemical that you wanted to test according to the instruction being tested during examination. So now let's go to glucose. For glucose, so for glucose, glucose is negative, as you can see. It's negative for glucose, doesn't change any color. See it here. And always check on the manufacturer's instruction. You see 2 pluses, 3 pluses, right? So for glucose is nil. So you indicate nil. Remember, for this patient, we said we want to know the glucose level. So the patient is not diabetic because there is no glucose in the urine. Then we check for protein. Also, there is no protein in this urine. And then we check for ketones. For ketones, we have 0.6, of which it's normal, right? So as we go on and on and on and on, depending on the question, then we note the result, isn't it? Then we discard it inside used instruments, right? So for now, the question says that we should just check for glucose, and there is no glucose in this urine. This patient is not diabetic, right? So we discard and we are done with this. You can also turn the urine back, put it inside. I have soapy water and clean water, so I can rinse it here and then wash it with soapy water. Then the next step is for me to rinse clean water, right? So the next thing now is for me to check the specific gravity of this urine, right? Remember, we have done the pH already because we are using Combi 9, isn't it? So we note, you also note what you have gotten. The next thing now is for us to take the beaker. You can turn it this way directly into the beaker, and also you can use syringe to withdraw. Do you understand? So make sure that the test tube has a flat basement so that you can place it on a flat surface. Whenever you want to carry out specific gravity of the urine, always know that the test tube has flat basement and is being placed on a flat surface and is standing properly. So you can use the syringe to withdraw the amount of urine that you want and put it inside the test tube. Remember, for specific gravity, you don't have to fill up the test tube. Put it halfway because you are going to use urinometer to carry out to know the specific gravity of this urine, right? So now you dip in this into the test tube. Do not allow the urinometer to touch the edges surrounding the test tube. See, it is floating. It's not touching the test tube. Look at it. It's floating. It's in the middle, right? So you note, do not shake it. Always make sure that it is standing. Do not touch the trolley or the table that you are using. If it is table, maybe it's better because the table may be strong and heavy. But if you are using some trolley like this, please avoid shaking it. Look at it now, it's shaking, right? So it may shake the urinometer and you may not even get it. You may not get the specific gravity of the urine rightly. So avoid, just look at it at eye level. Remember, there are some graduations on the urinometer, right? So you look at, immediately you dip in the urinometer, then you use your eye and then look at it and the specific gravity of this urine. Let me teach you how to do that. Do you see where the urine stops? On top, right? So with the number that the urine stops there, that is your specific gravity. The number, not inside though, not inside, just the one at the top where the urine stops, that is your specific gravity. And the specific gravity of this urine is 1.030. Then we note it, right? 1.030. And again, we note it. You know, up till now, there is no urine that touches my hand. I did not have any physical contact with the urine because I use syringe and I'm carefully turning it, so I didn't touch anything, right? And I didn't touch the urine. So what we are going to do now, we have noted the specific gravity of this urine, and we have noted that the glucose, isn't it? Glucose is nil, isn't it? Protein is nil, right? And nitrate is nil. Specific gravity is 1.030. Remember, it's not always like that. So whatever result you have gotten, just like any other test, like when you are carrying out vital signs, when you are carrying out vital signs, the result that we have gotten when you put the cuff, you inflect and deflect, right? That is what you are going to record. What you've gotten, systolic or diastolic, that's what you are going to record, isn't it? The same thing with this one. It's not static. It's not the same all the time. Depending on the concentration of if the urine is highly concentrated, the specific gravity will rise. If the urine is not highly concentrated, you will see the specific gravity will just drop, right? So now I've noted, and I didn't touch any urine, right? So I can also bring out my pen again and record and continue recording. Remember, we have put our formula, which is what? Dorcas. So remember, during exams, do not go and be mentioning what? Dorcas. Do not do your Dorcas. Just say that I'm going to do what? Physical examination. And when I'm done with the physical examination, I'm going to do what? Chemical examination, because it is divided into two headings, right? Physical and chemical. So when you write this, right? Then you write here glucose. Glucose what? Nil, right? Nil, glucose nil. Specific gravity. We say specific gravity is 030. And we say the color is what? Okay. And then we say what? The amount is what? 200 mils, right? ml and pH is what? We've taken the pH, and then the order is automatic, and we have deposit. Of course, deposit present. Is it blood? Is it pulse? Isn't it? And we are done with this urine testing. You've record. If it is during exams, you give it to your examiner. Sir, this is doing it. Remember, if it is a procedure that you are being asked to carry out, as you are doing the procedure, you want to report as you go. Report as you go means what? I am checking the physical examination, carrying a physical. So the physical examination of this urine means I have to check the deposit, the color, the amount, the order, right? You keep mentioning. So that is reporting as you go, or report as you carry along. Most times in Nigeria, most examiners do write, if you are carrying out a procedure, of course, they will say, report as you carry along, relate as you carry along, Report as you go, depending on the English the examiner wants to use, right? So please, whenever you are carrying out a procedure like this, do not keep quiet. Do not come to your table. You want to carry out examination like this, a test like this, and you start writing, be quiet, while the instruction said carry out glucose test on this specimen before you report as you carry along. And as you are doing, just keep quiet. You are just deposit. You're not talking. Remember, the examiner will start reducing. If each step is one mark, the examiner will start. So please be mindful of report as you carry along. Report as you carry along means what? Explaining each step that you are carrying out. Do you understand? Do you have any question? Any question? Yes, yes, yes. Concentrate here. Just here, concentrate here. Don't do. Yes, yes, go ahead. Because if somebody is diabetes, right? So there may be ketones in the urine. So you want to know, is there any ketone in this urine? Just like glucose, isn't it? Just like glucose, do these patients have glucose in the patient's urine? Remember, this is a practical class, right? So when you are in your theory class, they explain it. If there are ketones in the urine, it indicates that there is more problem to these patients that we are seeing, right? So the patient needs to be treated on that. That is the of blood in the urine. What is it? What is it causing this blood? Is it that the patient has a trauma in the urinary tract? Okay, you saw pulse, isn't it? In the deposit. Okay, what is happening? Maybe there is an infection, right? There is an infection in this particular patient. So you check that you so that you know what is the microorganisms, the pathogens inside this what pulse, inside this urine. Then you know from the lab it will tell you this is present, blah 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 blah. Then further for further actions will be taken concerning that patient prescribed. That will lead to the prescription of the type of drug that the patient will be placed on, right? Okay, have I answered your question? Is to know the concentration of urine, right? Is to know the concentration of the urine. Hello? Any question? Type of question we can be able to as they carry out to what percentage? Really? 90%. 70% of course is still A, isn't it? In Nigeria it's still A, 70%. So you can still carry out. Please do not forget to start with physical examination. Do you know that during exams, that physical examination carries almost all the marks? So do you understand? Almost all the marks. So if you jump physical examination, you have jumped almost all the marks, and you say I will just do what chemical exam like glucose, ketones, proteins. That one is just like 1 mark. Of course, yes, that one is just like 1 mark. Please start it step by step. Also take note of what expiring dates, and immediately you remove, you cover it. You cover the container, right? Any question? So can you tell me what we've done today? Can I ask you a question? Since you don't want to ask me, who can tell me, class? Who can tell me what you are expected to do? The first step in urine testing, and when you are going to carry out a procedure, what are you expected to do for this type of procedure? Okay, you first of all perform hand hygiene, right? What about the second step? So we don gloves, isn't it, to protect ourselves, isn't it? Let's take for instance this patient is having hepatitis B. Bare hands to carry out this procedure because it will have direct contact with your skin, right? So what is the next step after performing hand hygiene, physical examination? The next step, if you know the answer, raise your hand and tell me. Huh? If you know the answer, raise your hand and tell me. Nurses are orderly. We are always orderly in whatever we do. Yes. Yes. Oh, yes, 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 yes. Tell me. Tell me, somebody raise a hand here. Okay, the next thing is for us to perform physical examination, and physical examination consists of what? One person. If you know the answer, just raise your hand and tell me what answer. So you know deposit, right? You check the amount where the urine by physically seeing it with your eyes, whether there is what particles, blood big, blood clots, whatever. Isn't the next thing? Raise your hand. Remember to orderly. Yes. Okay, we check for the odor. And what is the odor of the urine? As you know, aromatic or characteristic smell, right? So the next, what's the next thing when we want to carry out physical exam? Yes, you are at the back. Of the urine, is it amber, is it deep amber, is it clear amber, is it, you know when somebody takes lot of water, the urine will be very clear as this water. It will be as clear as this water, right? The urine is clear, that means that person is taking enough water. But if the patient is not taking enough water, you will need to be deep amber, right? So what's the next thing? Yes, amount, of course. We said that if you want to check amount, what will you do? Raise your hand. So you got to raise your hand. The graduating. All right, we place it on a flat surface and make sure that the urine is a clear container that you can see, right? So what's the next thing? Physical examination. So now we enter into the chemical. Okay, that's the next step, and we check based on the question or the instruction being asked. Remember, this class is concentrating on nursing procedure. Do not forget, this class is only concentrating on nursing procedure on how to carry out urine testing. So we'll go to the next. That is what? Chemical examination of this urine, right? Then we remove what? What's the next thing? And then the other one is what? You either use, not always Combi 9 class, you can also use Combi 2 or Combi 9. The advantages of Combi 9 is that it contains lots of chemicals that you can carry out the test at the same time, right? But Combi 2 is only, for like this product, is only glucose and hydrochloric acid, nitrate, you can taste it, right? So that is it. And you remove immediately, you remove the strip and test it and close the container, and then you test, right? So now, since we have understood what I have taught you, any question, you return the urine back into the beaker. and also put it in a soapy water to rinse it, right? We rinse it. Remember, as a student nurse or as a nurse, you are carrying out this kind of procedure. Look at how I carry out my procedure. Clean, no urine. No a drop of urine on my table or on my trolley. Look at my paper. No stain of urine at all. So you see, so kindly also whenever you are carrying out a procedure like this, always do your test, carry out your procedure what neatly. And when you are done, what are you expected to do? If it is husky, you do what? Rearrange your used equipment because you have what? Next candidate that is coming. You have next candidate that is coming to carry out the same procedure. So now I want to rearrange my table, right? So I have to wash. Remember, this is a soapy water. This is a soapy water, right? Rinse the test tube. And I place this here. This one I turn it upside down because I've placed. Then I what? And I discard my syringe. When you are doping glove class, be mindful of your body. Be mindful of your hand, isn't it? Always pinch the glove this way, right? Pull it and then remove your hand. And use your non-dominant hand and close it inside. Then you use your index finger and put the index finger this way and then remove it. Contaminate your body and then discard it into the bin immediately. You come, then the next thing is for you to what? Perform hand hygiene again, isn't it? You perform hand hygiene again, right? Remember, I just removed glove. Pardon me, I'm not using running tap. I'm using this water in a basin to do that. So, any question? You don't have any question? That means you have understood everything.
Yes, ma'am.
So, if I set this as an exam, you are all going to pass.
Yes, ma'am.
I encourage you, please go and read. Read your, always go back, reverse what you've been taught in the class, and then I'm telling you, always you get A's in your class. Remember, all these always 3 credit units, so don't joke with it. And it's easy to fail, easy to pass, easy to get, easy, very easy to get what? A in all skills. So you don't have to stress yourself. Just always come to class, always read, always come and practice, right? And before you know, you'll be having 4 points, 4 points, 4 points as your CGPA. So thank you for watching my videos. Thank you. Please remain blessed. But do not forget to like, share, and subscribe to my YouTube channel. We've come to the end of this video. Thank you. Bye Let's go.
Okay, are you sure you want to?
And stop